Hello, dear students. Welcome back to your channel. I love Pharmacology. So, in this session, let us learn about a very important topic on insulin analogs. So, as you know, that insulin is one of the endocrine hormone which is released by the beta cells in the pancreas. So, this insulin analogs are mainly used in the treatment of type 1 diabetes as well as in case of type 2 diabetes mellitus whenever they are not getting enough blood sugar control for oral hypoglycemic agents. So let us see one of the insulin analogs, that is the rapid acting insulin. Why they are called as rapid acting insulin? Because these insulin will going to act once you administer these insulin, it will going to act within 0 to 20 minutes. It's very quick in onset of action. So it has to be given just before meal. That means to say you can give just before breakfast or before lunch or before dinner. So these rapidly acting insulin analogs are made up of weak hexamers. They contain weak hexamers of insulin molecules. So why they are acting rapidly? These weak hexamer molecules will get dissociated at the faster rate. So this is the reason why they are rapidly acting in nature. So what is the advantage of rapidly acting insulin? So one of the very important advantages of rapidly acting insulin is it will going to control or decrease the episodes of postprandial hypoglycemia. That means immediately after the meal, the hypoglycemic episodes will be less. So main advantage is it will going to prevent the postprandial hypoglycemic attacks. What is the reason? Because it has quicker onset of action and its duration of action will stay for 1 to 3 hours. 1 to 3 hours. So usually these drugs will going to reach a peak at 1 to 3 hours, and maximum duration where this rapid acting insulin can act is the 3 to 6 hours. So basically it acts within 0 to 20 minutes following administration. It reaches the peak within 1 to 3 hours, and its maximum duration is between 3 to 6 hours. So which is the route which is preferred for administration of rapidly acting insulin? It is subcutaneous route. Please remember, most of the insulin are commonly administered through subcutaneous route. So here let us see the examples for rapidly acting insulin analogs, which has been asked in your exams many times, and also it is very important topic in terms of MCQ related questions also. So what are the examples for rapidly acting insulin analogs? You have insulin lispro, you have insulin aspart, you have insulin glulicin. So you can remember it as lag. So L stands for lispro, A stands for aspart, G stands for glulicin. So usually the insulin aspart will mimic the physiological way of insulin release, whereas glulicin can be used in the form of continuous sustained insulin administration in the form of pump. So usually this rapid acting insulin can be combined either with the neutral protamine egadron, which is also called as isophane insulin, or it can be combined with the regular insulin. Okay, in continuation with the rapid acting insulin analogs, As you know, what are the examples for rapidly acting insulin analogs? You can remember it as, so as we discussed earlier, you can remember it as lag. L stands for Lispro, A stands for Aspart, G stands for glycine. So there are some important points which you need to remember about rapidly acting insulin analogs. So please remember, these are also called as prandial insulin analogs. Prandial insulin analogs means to say these rapidly acting insulin will control the mealtime hyperglycemia. Mealtime hyperglycemia. Pran means it is meal. Pran means it is meal. So usually this rapid acting insulin will going to decrease the postprandial postprandial hyperglycemia. So but everybody cannot use it because of it is relatively costlier in nature. So these drugs are relatively costlier in nature. And why it has been used for control of the prandial rise in blood glucose? Because of their shorter acting. So because of their shorter acting, one of the advantage is it will going to decrease. One of the advantage is it will going to decrease the postprandial hypoglycemic episodes. Please remember, because of their shorter acting nature, it will going to decrease the episodes of postprandial hypoglycemia. So where you want to use this rapid acting insulin preparation, it can be used both in case of type 1 where there is a complete deficiency of insulin, or you can use it in case of type 2 diabetes mellitus, where if the patient is not controlled by oral hypoglycemic agent, you need to shift it on the insulin analogs alone or in combination with the oral hypoglycemic agent. Please remember, these rapidly acting insulin analogs will going to control the prandial rise in blood glucose. So this is the main reason why you want to use the rapidly acting insulin analogs, because it controls the prandial rise in blood glucose levels. So these analogs are used in the form of insulin pumps also, where there is a constant and sustained release of the insulin. Please remember, one of the major side effect of rapidly acting insulin analogs is the hypoglycemia, but occurrence of hypoglycemia is very rare. Okay, finally coming to the I Love Pharmacology capsule, where you're going to learn the glimpse or summary of the present topic. So today's capsule will be on very rapid acting insulin analogs. Please remember, this rapid acting insulin analogs can be called as very rapidly acting insulin analogs, or they can be called as short acting insulin analogs, or they can be called as faster or fast acting insulin analogs. So please remember, under rapidly acting insulin analogs, you have got examples as lag. L stands for Lispro, A stands for Aspart, G stands for glulicin. Please remember that these rapidly acting insulin molecules are similar to that of, please remember, they are similar to human insulin. They are similar to human insulin, where there will be some switch over or exchange of the amino acid will be made in the B chain of the insulin to make it a very rapidly acting insulin analog. Here you can see that in the Lispro, there is a exchange of proline with lysine. So proline lies at B28, whereas lysine lies at B29. There will be exchange or reversal of this amino acid in case of Lispro. Whereas in case of aspart at the B28, so there will be aspartic acid replaces the proline. Whereas in case of glulysin, so at B29, the glutamic acid will going to replace the lysine, and at B3, the lysine will going to replace the aspargine. So because of this switching over or replacement of the amino acid, what will happen to these insulin is there will be decrease in the self association. That means to say it will going to increase the dissociation rate, thereby their action will be instantaneous. That means to say, here you can see that whenever you give a rapidly acting insulin analogs, so these hexamers will going to dissociate very rapidly into monomers, that is responsible for its immediate or instantaneous action. So these drugs are usually given before meal. Before meal, please remember it is administered before meal, either just before the breakfast or during lunch or during just before dinner. It has to be administered 15 minutes before the meal, and it will be administered through subcutaneous route. Once you administer just before 15 minutes, why you want to administer just before 15 minutes? It's at onset of action. Please remember, it's onset of action is around 0 to 20 minutes. So action will take place, and it will going to mainly control the glycemia after meals. So that is the reason why these rapidly acting insulin analogs will going to control or reduce the postprandial hypoglycemic episodes. So usually it acts within 0 to 20 minutes. The reason being, again, so there will be faster dissociation of the hexamer into the monomeric molecules. All this is possible mainly because of some exchange of amino acid or some exchange of replacement of amino acid at particular site of the beta chain. And next, what happens is, here you can see that, so because of their instantaneous action, they're going to absorb rapidly, and it is very short acting in nature. So usually the peak onset of action will be seen within 1 to 3 hours, and the whole duration of action will be for around 3 to 6 hours. So please remember, apart from that, the most common the side effect you can encounter, but it is rarely seen, or the chances are very less with these rapidly acting insulin analogs, is the hypoglycemia. So one of the disadvantages is very costlier in nature, and these insulin analogs can be combined with either the regular insulin or with the neutral protamine hexadron insulin, which is also called as isophane insulin, and regular insulin is also called as soluble insulin, whereas NPH is also called as isophane insulin. So this was about the class on the very rapidly acting insulin analogs. If you find this video useful, please do subscribe to my channel. I love pharmacology, and do not forget to share and hit the like button for more updates on interesting topics on pharmacology. Thank you.